Before I get started with the Black Health Foundation series for the month of February, I wanted to take a couple minutes to explain why we're doing this series. I decided to do this not from a marketing perspective or not from a trend perspective, but from a very personal one, because this didn't, for me, just start with the podcast. It started long before that at the bedside, in hospital rooms, in clinics, but also as a child in my own body, because I was born with a congenital heart defect. I spent years working as a nurse, and I've seen a lot in my time, and a good portion of my career has been taking care of people that have chronic conditions like hypertension, kidney disease, diabetes. I've taken care of people in various stages of cancer, with various cancers. I've taken care of people who have wounds for various reasons because of complications from most diseases. Usually I've taken care of people with sepsis and really bad infections that have spread through their body and through their blood. So I've taken care of people, adults of every age in every phase of life, through death, because I've also done hospice for quite some time and I've pronounced quite a few deaths. But I'm also a very observant person. Most nurses are, because we have to be, because so much communication is nonverbal and there's so many things patients don't tell us, but we see and know just because of our training and assessment skills and observation skills. And I'm a big people watcher. I have a hard time turning my assessment skills off when I'm just out and about. But I'm a big people watcher. I watch people at sporting events, when I'm shopping, at work, just everywhere. I'm always watching people. And it blows my mind how many people I see walking around that are unhealthy. And I'm not saying they're unhealthy because of their weight, unhealthy because of other things. Your weight is not always an indicator of a chronic condition. There's lots of other things. I can see arthritis from looking at your hands. I can see respiratory things from looking at your nail beds and in your face. I know you have cardiovascular things based off of where your belly fat is and how far out it is. I look at people's ankles and I see their circulation issues. So it's all kind of things. It's not just your weight. But I feel like because I see so many people, more that I would say are unhealthy than healthy in a lot of circumstances, is that I don't believe people are just walking around wanting to be like this. I think people just truly don't know where to start, or they have some false belief that they can't be helped or that it's inevitable because their whole family's like that. I've also heard that going into people's homes, teaching them how to take care of themselves from being a home health nurse. What I've seen most consistently over my career is not some drama-filled thing that you see on TV in an emergency room setting or a surgical setting or something like that. I see a lot of slow, progressive, preventable complications from diseases that are costing people their lives. And I don't think they're intentionally choosing this. I've cared for patients who were living with high blood pressure, diabetes, kidney disease, heart disease, not because they didn't care. I know they care because they're going to the doctor, they're taking their medications, they're getting labs when they're supposed to. If doctors recommend procedures or tests or second opinions, they do those things. So you don't do those things if you don't care. You do those things because you do care. But I also noticed that they were never truly educated on how to use the tools of the healthcare system to help them live with, reverse, or minimize the complications of a disease on their body. What I do see, I see them being told what is wrong. I see them being told what medication they need to take. But like I said, they're very rarely told why they ended up in the situation they're in, what happened to their body that got them there. And they're not taught how to navigate the healthcare system in a way that actually supports them long term. Because there's very few diseases that you can't live with or reverse or minimize the complications and damage to your body if you know what to do and you don't wait till the last minute to act. I've watched people die earlier than they should have. Not suddenly, not in traumatic accidents. I've never been an ER nurse or practitioner. But I've watched them die early after years of complications, years of declining quality of life, years of declining independence and increased dependence on other people. Because what people don't talk about enough is that when someone gets sick, when a matriarch or a patriarch of a family gets sick, the entire family becomes sick too. I've seen families financially devastated by the cost of medications, repeated hospitalizations, treatments for complications from the original problem, lost work, and I've watched caregivers burn out. I've seen children grow up watching their parents struggle. I've watched children become caregivers to their caregiver, sometimes while they're still children. I've seen people lose years of quality life, not all at once, but piece by piece over time due to the lack of taking action to help their body. And so often, when I get to sit down with people and talk to them about it, or they end up in my functional medicine practice as a last resort, I hear the same things all the time. This just runs in my family. I knew it was going to eventually happen. It was inevitable. There's nothing I can do about it. My doctor didn't explain it to me, so I guess this is just how it is in the situation I'm in. I want to be very clear. If you've heard those myths or believe those myths, it doesn't mean that someone failed you or you were led astray. It doesn't mean that someone didn't try hard enough to get through to you. What it means is our current healthcare system teaches management of chronic conditions far better than we teach understanding and listening to your body and preventing chronic conditions. So that's why I created this series. Because people need accurate, honest information in a digestible form so that they can make informed decisions for their life and for their health. I've also lived a lot of these things in my own body. I've navigated hypertension myself. I still navigate hypertension on a daily basis. And I shouldn't say by myself, but I navigate hypertension. I take medications for it. I've had high blood pressure actually since I was in my 30s because a lot of the lifestyle choices I was making as an entrepreneur and trying to move forward professionally caused damage to my heart, which led to hypertension. I've struggled with fertility issues. I've had 7 miscarriages, I believe. Not miscarriages in the first trimester either. Miscarriages later in a pregnancy, but too late to save my child. I've dealt with weight changes. I've weighed as much as 230 pounds. Now I'm somewhere between 150 and 160 pounds. But I struggled with weight issues. I am only 49. I struggled with a lot of this stuff in my late 30s and early 40s. which was a big wake-up call for me. If you would have asked me, was I healthy? I would have told you yes. If you asked me, did I eat healthy? I would have told you yes. But at 40, I found out I was suffering from significant nutritional deficiencies that was causing me so much pain and discomfort, was causing me anxiety and depression. And I'm getting put on all these medications to try to treat these symptoms that I'm having, when the issue was I had no vitamin D. Normal vitamin D level is 30 to 100. My level was 2. My doctor literally sent me to have my entire body scanned to make sure that I didn't have any hairline fractures or breaks somewhere that needed to be addressed, because he just couldn't believe it. So me, being a healthcare practitioner, being a nurse, educating other people, working in the system, I was told too, your labs are normal, even though I didn't feel normal. Everything looks fine, because I did look fine. If you asked people who knew me at that time in my life, they probably would have not said anything was wrong with me. They would have said I looked fine, but I was not fine. I believed I needed to try harder. I needed to try harder to eat better. I needed to try harder to exercise more. I needed to try harder to lose weight. And I thought if I truly tried harder and became more disciplined, things would get better. That was not the case, because my body was telling me something else. And I know there's a lot of people that have been in that same situation. That disconnect between the body and experiencing what your system is trying to explain to you is where so many people get lost. What I've learned from my personal and professional experience is most people are never ever taught how to understand their diagnosis beyond the label of that disease. Like if you go to the doctor and your doctor says, you have high blood pressure, do you know what's supposed to happen next? Do you know what to do after you hear that? We're never really taught what to do after we're diagnosed with something, aside from whatever instructions our practitioner gives us. Are you asking the right questions? Because most people aren't. Are you using the medical system as a tool instead of feeling powerless in it? Because most people are not. That's a big part of what I do. Teaching people how to use the medical system as a tool, because that's what it is. That's what your providers are. That's what healthcare practitioners are. That's what the entire healthcare system is. It's a tool to help you stay healthy and prevent things from happening to you so that your body functions at the max potential. The healthcare system or your healthcare practitioner is not responsible for your health. You are responsible for your health. They are a tool to help you accomplish whatever health goal you want to accomplish, but they are not the end all be all. And that is the mindset of a lot of people that use the current healthcare system, because that's what we're taught to believe. We're not taught how to recognize early warning symptoms. And if you do know what the early warning symptoms are, do you know what to do when you start experiencing that stuff? Usually not. We also believe myths instead of actual physiology that have been passed on to us from generation to generation, or that you heard on some social media channel from someone who's never taken care of a person before and probably doesn't know any science or anything about how the body works or how diseases occur and what they do to the body. And we're not taught how to communicate effectively with healthcare providers, who a lot of times are often rushed and overburdened. So things are missing. And when education is missing, chaos fills those gaps. Fear fills those gaps. Misinformation fills those gaps. Silence fills those gaps. This series exists because I don't believe education should occur after a health crisis. I don't believe Black people or Black health conversations should start with fear or end with the inevitability. And I don't believe we talk enough about the cost of not understanding what's happening to your body. And I'm not just talking about the financial cost, but the emotional cost, the cost to relationships, the cost to the health of generation to generation of your family. If you're listening to this and dealing with high blood pressure, blood sugar issues, excessive fatigue, chronic stress, fertility challenges, weight changes, or any chronic condition, it does not mean something is wrong with you. It means your body's been adapting to functioning the wrong, even though it's not working properly. That's often because of stress. It's often because we have to survive. Life is hard. Life is very hard right now. Life is very stressful right now. But we have to keep pushing forward. You gotta survive. But we're trying to do it without enough support, without giving our bodies the best opportunity to recover. You just adapt and keep on going. But eventually, your body's going to stop being able to adapt. And you're going to stop feeling good. And then you have crisis. Understanding the first step is really one of the most important steps in changing the trajectory of your health without panicking and without placing blame. Because panicking is not going to help you move forward, and blaming yourself or someone else is also not going to correct the situation. So this Black History Month series is about slowing these health conversations down. Not oversimplifying them, but not shaming people or promising quick fixes. Because most people with chronic health conditions that are affecting their life, it did not happen overnight. It took you a minute for your body to end up in that situation. So it's going to take you a minute to fix it, but it can be fixed. Because knowledge doesn't just change lab numbers. It changes your family's plan for dealing with your health. It changes how you and your family advocate for your health. It changes health outcomes over time, which will change your life. Because when you are just adapting and not functioning properly on all cylinders, you are not living life to the fullest. You are not functioning at max potential. You're not even tapping in your max potential, because you can't when you don't feel good and you're just adapting to whatever is presented from day to day. If you've ever felt confused, dismissed, overwhelmed, or resigned about your health, this series is for you. And if you've ever watched someone you love struggle through preventable complications, this series is for you. We're doing this because understanding changes everything, and you deserve that. Now, let's talk about what the series is. The series is going to be mini podcast episodes from 5 to 10 minutes about one specific health topic every day. Today is Friday, February 6th. So I'm a few days behind because I had tons of family commitments this week. But we're going to get caught up in 4 days, because we're going to drop 2 to 3 over the next 3 days, so that by Monday the 9th, we are caught up and on day 9. So that's how we're going to move forward with the series. But also, each mini episode also comes with an ebook and a workbook. Because everything I talk about on this podcast is meant to be information, not instruction. I'm trying to make you aware, not overwhelm you, so that you can hopefully start to make informed choices about your health. I'm just creating a context to to talk about our health, not drawing any conclusions. Because understanding your health isn't about fixing yourself overnight, it's about being able to see the full picture. I created an ebook and a workbook to go with every health topic. And yes, it is going to be a different health topic that affects Black men and women and people in general, actually, throughout the month. Like the first episode. Day 1 is hypertension. Day 2 is diabetes. 2 of the biggest health issues impacting the Black community. Impacting Americans, period, but especially the Black community. And I created the ebook and the workbook to go with each episode because conversations like this can't always be processed in one sitting. Sometimes you need to pause, reflect, reread, re-listen, think back to try to notice some patterns. And that's what the ebook and workbook tools are for, to go a little bit deeper. Not necessarily to give you a to-do list or tell you what to change, but to give you a space to really reflect and ask yourself some questions about like what this looks like in my body. What patterns am I noticing after I actually know what to notice? What questions do I need to bring to my provider, to my family, to a loved one, or to yourself? The ebook goes deeper into the education aspect, the why behind what we discussed that day, and it explains what most people were never told in a way that's calm, clear, and culturally grounded. The workbook, which is the second part of the ebook, is where the conversation becomes more personal and it gets you to slow things down and reflect without judgment on how much stress are you really experiencing. Talks about your energy, consider symptoms, consider your beliefs, your habits, and stories you've been told about your health. You don't need to complete it all at once. You don't need perfect answers. Sometimes the most powerful shift you can make for your health is simply noticing something for the first time and deciding to take action. And here's something I really want you to know, because I'm a big believer in this. You don't have to do any of this alone. If you are looking for ongoing guidance, education, some kind of structure, not quick fixes, but someone to really support you and guide you the right way, that's what I do. That's what my practice is. That's what my functional medicine practice and health coaching practice is for. It exists to support those longer conversations and support you on this journey, because there's very few health fixes that are quick fixes. It requires time, it requires support, it requires patience, it requires accurate knowledge. And that's what we do at Holistic Health Quest. That's what I do as a healthcare navigator. I create a space for people who want to understand their health over time and learn how to, and I teach them how to use the medical system more effectively and make decisions from clear-headed clarity and not with fear. It's no pressure, just an option that I want to make sure you know is available to you, okay? And how to utilize all of these tools, whether it's Holistic Health Quest, me as a healthcare navigator, the ebook, the workbook, they're all in the description and notes of each mini podcast. As you move through the series, my hope is that you start to feel less confused, less blamed, and more confident in asking questions and more empowered to take control of your health, whether it's with your provider, your family, or by yourself. Because when understanding changes, outcomes changes, and when outcomes change, your life changes for the better. Like I said, not overnight, but over time. Over time is where real health is built. Thank you for being here. I hope you enjoy this series, and thank you for being willing to have these conversations with yourself. I'll see you in the next episode. Be well.
Welcome back to the podcast. And if you're new here, I'm so glad you're listening. This is a space where we talk about health in a way that's clear, grounded, and realistic, without fear, judgment, or pressure. Why this topic matters now. Today we're talking about diabetes, but not in the way it's usually discussed. Most people in the Black community have heard some version of, just stop eating sugar. Diabetes runs in our family. It's all about willpower. Here's why this matters. When health is oversimplified, people blame themselves instead of understanding their bodies. And this doesn't mean something is wrong with you. It means the conversation has been incomplete. What's commonly done in standard care? In standard care, diabetes conversations usually focus on blood sugar numbers, a diagnosis label, medication or insulin, avoiding sugar. Those tools can be important and life-saving, but most people are never told why blood sugar starts rising in the first place, especially years before diabetes is diagnosed. What's often missed or overlooked? Here's what's often overlooked. Diabetes doesn't usually start with sugar. It often starts with insulin resistance, when the body has trouble responding to insulin efficiently. Contributors may include chronic stress, poor sleep, inflammation, long-term cortisol elevation, muscle loss with age, repeated blood sugar spikes from refined foods. Many Black adults are exposed to high stress plus limited recovery for decades, and the body adapts. This doesn't mean failure. It means physiology. Common myths in Black health culture. Let's gently unpack a few common myths. Myth number 1. If I stop sweets, I won't get diabetes. Sugar is only one part of the picture. Myth number 2. I don't eat that bad, so this doesn't apply to me. Blood sugar responds to stress, sleep, and muscle, not just food. Myth number 3. Once you're diagnosed, it's downhill. Many people stabilize and improve their health trajectory with education and support. This is about understanding patterns, not predicting outcomes. Signs and symptoms people often ignore. Many early blood sugar issues don't feel dramatic. You may notice energy crashes after meals, brain fog, increased thirst, frequent urination, sugar or carb cravings, fatigue that doesn't improve with rest. Think of these as signals, not diagnoses. Simple, gentle fixes to consider. This is not about restriction or perfection. You might consider eating protein earlier in the day, pairing carbohydrates with fiber and fat, walking briefly after meals, prioritizing sleep consistency, noticing how stress affects cravings. Small shifts, consistently applied, matter more than extremes. What to do if this sounds familiar? If any of this resonates, ask your provider about insulin resistance, not just A1C. Discuss trends over time, not one lab value. Track how you feel after meals. Focus on sustainable changes, not quick fixes. This is information you can use, not something to fear. I have created an optional companion ebook. Title: Beyond Sugar, a Black Adult's Guide to Blood Sugar Awareness. Inside the guide, what insulin resistance actually is, why stress and sleep matter as much as food, cultural food context without shame, simple meal pairing strategies, questions to ask your provider, easy self-awareness trackers, educational, non-diagnostic, designed to create clarity, not pressure. Thank you so much for spending this time with me today. If this episode helped you see diabetes differently, please like, share, follow, comment, and rate the podcast. It's free, and it truly helps this information reach more people. If you'd like ongoing education, structure, and support, you can join Vitality Catalyst, our membership focused on long-term health strategy and prevention. And if you're interested in becoming a patient in the practice, that information is linked as well. Everything here is about understanding your body, not rushing it. I'm really glad you're here. I'll see you in the next episode. Welcome back to the podcast. And if you're new here, I'm so glad you're listening. This is a space where we slow health down, explain what most people were never told, and talk about long-term vitality without fear, pressure, or judgment. Why this topic matters. Today, we're starting Black History Month by talking about high blood pressure, because this is one of the most common health issues in the Black community, and also one of the most misunderstood. Most people are told, it runs in your family. It's just genetics. This is normal for us. Here's why this matters. When something is framed as inevitable, people stop asking questions. And this conversation isn't about blame. It's about information. This doesn't mean something is wrong with you. What's commonly done in standard care. In standard care, high blood pressure is usually handled like this. A number is high. A medication is prescribed. The goal becomes lowering the number. That approach can be necessary and helpful, and it saves lives. But what's often missing is context. What's often missed or overlooked. What's rarely explained is that blood pressure is influenced by chronic stress exposure, salt sensitivity combined with low potassium intake, poor sleep quality, inflammation, nervous system overload, long-term emotional pressure. Many Black adults have lived in high-stress environments for decades, often while being told to be strong and push through. Strength has a physiological cost. This doesn't mean something is wrong. It means your body adapted, and adaptations can be adjusted. Common myths in Black health culture. Let's gently clear up a few myths. Myth number 1. Everyone in my family has it, so I will too. Family patterns often reflect shared environments, stress, and habits, not destiny. Myth number 2. If I don't feel symptoms, I'm fine. High blood pressure is often silent. Myth number 3. Medication means I failed. Medication is not a moral issue. It's a tool, not a verdict. Signs and symptoms. Educational, non-diagnostic. Many people don't notice anything at all. Others may experience frequent headaches, dizziness, shortness of breath with mild activity, chest tightness, fatigue, trouble sleeping. Think of these as signals, not diagnoses. Simple, gentle fixes to consider. This is not a to-do list. It's an awareness list. You might consider tracking blood pressure at different times of day, noticing how stress affects your body, looking at sleep quality, not just hours, increasing potassium-rich foods, practicing calm breathing daily. small inputs matter. What to do if this resonates. If you're experiencing any of this, have a calm conversation with your provider. Ask why your numbers may be elevated. Discuss lifestyle contributors, not just medication. Track patterns, not isolated readings. This is about partnership, not fear. I have created an optional companion ebook, the Blood Pressure Reset Guide. Purpose: a deeper educational breakdown of why blood pressure rises over time, stress and nervous system impact, cultural food considerations, simple tracking tools, questions to ask your provider. No diagnosis, no treatment plans, just clarity. Thank you so much for spending this time with me today. If this episode was helpful, please like, share, follow, comment, and rate the podcast. It's free, and it truly helps push this information out to more people who need it. If you're looking for ongoing guidance, education, and structured support, you can join Vitality Catalyst, our membership focused on long-term health strategy and prevention. And if you're interested in becoming a patient in the practice, you'll find that information linked as well. Everything we do here is about clarity, not urgency. I'm really glad you're here. I'll see you in the next episode.